To today's health alert, new CDC data shows measles cases are climbing across the country. The U.S. has already seen roughly 4 times more cases in 2026 than we usually see in an entire year. Joining us now is our chief health editor, Dr. Partha Nandi. Doctor, what is the latest update with these cases, these outbreaks, and which state is seeing the largest outbreak?
Yeah, it's just amazing, right? And there's been at least 733 confirmed measles cases reported nationwide. To put that into perspective, Whitney, the U.S. averaged about 180 measles cases a year since 2000 when measles was declared eliminated. That said, last year was different, with more than 2,200 cases across 45 states. Now, what's driving these outbreaks is where they're happening. Around 97% are showing up in pockets of unvaccinated or under-vaccinated communities. And according to CDC, children and teens account for, get this, 85% of all cases, with 203 cases in kids under 5 and 417 amongst those ages 5 to 19. Adults make up 13% with 93 cases, and another 3% or 21 cases are of people with unknown age. As for which states have the largest outbreaks, it's South Carolina. An outbreak there began in the fall, and since then, the state has reported 920 confirmed cases, including 44 new cases just last week. Not great.
Some of those numbers you're saying are very scary. Where does Michigan stand as far as all this goes?
So we got a little good news here, right? So the good news is that Michigan does not currently have any confirmed measles cases in 2026, according to the latest state health updates. But it's still early, and last year we had about 30 measles cases statewide. So if numbers continue to rise nationwide, we could see more cases here. So the question is, what can we do for protection? Well, it really comes down to vaccination, right? The MMR vaccine is about 97% effective at preventing measles. That's really good. For kids, it's given in 2 doses, the first after a child turns 1 and the second between ages 4 and 6. Unfortunately, we're seeing vaccination rates slip. Nationally, MMR coverage amongst kindergartners has dropped from 95% in 2019 to below 93%. Herd immunity usually requires about 95% coverage. In my opinions, here's the thing, vaccines are safe, and I've chosen to vaccinate my own kids. If parents have questions, they should talk with their doctor, their pediatricians. Adults should also check their immunization records to confirm if they're protected. And if anyone develops symptoms, which is a high fever, a cough, runny nose, red watery eyes, or a flat red rash, please call a healthcare provider before going in to help avoid exposing others. The bottom line is that we just have to get people vaccinated and dispel all these myths about how vaccines are causing this and that. And if you have any questions, talk to your doctor. Don't go to TikTok.
Yes. A lot of misinformation is out there, and I'm sure it's a challenge to get around. Okay.
Exactly.
All right, Dr. Nandi, thank you so much.
My pleasure.
If you have a health question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or you can send it to us on Facebook or over on X.
All right, let's